So if we're going to focus on predominantly the knee-high range of garments that are available, but please bear in mind that these are all available in all the different styles, be they thigh-high, chap style, one-leg with panty, or in fact even pantyhose. So just let me take you through the knee-highs in terms of the different fabric options and perhaps give some idea of how they might feel and when possibly you might use them. So initially though, I think it's important to look at what we're looking at in terms of how Haddenham Healthcare garments can be ordered. So predominantly we break our garments into what is called stock, made to order, and custom made. So the stock garments is a range of garments that we hold literally in stock in the Melbourne warehouse. So they have a fairly standardised range that are held there and all different fabric options and a variety of different compression levels, but they don't have the entire range. So what you'll find is in stock is the more simplistic garments being the standard fits, the standard legs, the standard foot lengths. When we move into options that are what we classify as made to order, this gives us a scope of options that is beyond belief. So you will see that as we go through, you could choose a garment that's quite tailored to your specific patient's needs. So you might have a garment that's size 7, extra wide in the calf, with a 5 centimetre grip top, with a long closed toe and a T-heel, for example. That's just one example of combinations that you can put together. So you'll see when we work through with the made to order range that you select where your patient fits in the sizing chart and what particulars they need in terms of leg length, foot length, and any special features, top bands or no top bands. If you ask me what we have available, we have everything available. It depends on what combination you use and what combination you need. This is where garmenting becomes really broad, and that we hope to be able to meet someone's needs without having to go into a custom made garment unless your patient doesn't meet the sizing criteria. So there are definitely patients that don't meet the sizing criteria in our sizing chart. Perhaps they sway from very small to very large in the calf circumference, so they scan across too many sizing options. Perhaps they have some lobules, and perhaps they have some other special needs. So the custom made garmenting is designed just for those that really don't fit within the sizing criteria. There is no advantage of going custom made. If your patient fits in the made to order sizing chart, there's no advantage to going custom made. So what we've been able to put together is a diagramized view of how we think you might well be able to utilize the Haddenham Healthcare garments. And each of the different garments and each of the different fabrics has their own pros and cons. They have their own unique features. So this gives an advantage in that you really can suit your patient. What have they used before? What have they tried? What have they liked? What have they not liked? What is their skin condition? What is their donning and doffing techniques? Who's there to help them, if anyone? What have their past experiences been will help guide you where you might take them in the future with their garmenting. Remembering as well that garmenting isn't forever. So in a sense that you may choose one fabric and one garment for your patient this time round. At a subsequent appointment, maybe 3 or 6 months later, those garments will need replacing. So potentially you might learn from what you've done with your patient and walk through into a different fabric option. This is designed to give you options. So the charting system will guide you through from looking at someone with a mild edema, a moderate edema, to a severe edema. It will look through in terms of what their skin condition is like and what their special circumstances are, and it will give you an idea of what fabrics might be suitable for your patient. There's nothing more in this than some clinical reason, some baseline clinical reasoning on the pretense of understanding our fabrics. If you have more needs, if you are uncertain at all, please just contact the clinical advisors. They are there to help you and to work through all of these individual patient needs. So firstly, if we look at some of the fabrics, so I'm going to bring my leg over. We have a Pertex Light garment. Pertex Light is soft, it's stretchy, It's nice and fine, but it is a flat knit garment. So in the sense that it's flat knit, it will allow you to take all the benefits of flat knit technology in terms of its massage effect to the superficial lymphatics, its stay up ability, and it's easy on and off. So it's not highly elasticated in the sense that some circular knits can be. So you get the benefits of a flat knit garment, flat knit fabric, being with it only still in a class 1 compression. So meets the needs of those that are perhaps elderly, those that are perhaps going to have more difficulty donning and doffing garments, those that need some compression, but not high levels of millimeters of mercury. So it's probably more suitable for the milder edemas, but I've seen it used in situations where nothing else has worked. So something is better than nothing. Have your expectations set. And you'll find that Pertex Light achieves more than what you would imagine. And I believe that to be because it has that flat knit element to it. So we've moved through now. Let's suggest that you have a patient that needs slightly higher millimeters of mercury, but you still want soft and stretchy. You still want something that's light and easy to manage. So Pertex Class 2 comes in Class 2 and Class 3. So it is higher in its millimeters of mercury, still flat knit, still soft, still stretchy, still a little bit forgiving. Still can have any combination of top band that you might need, a narrow band or a wider band, no band at all if you prefer, closed toe or open toe, standard leg length, long leg length, standard foot length, short foot length. You can choose and combine up whatever combinations you're looking for. So we're looking now to moving on. So we looked at the Pertex Light and the Pertex Class 2. Let's say you have a patient that has some more significant swelling, or perhaps they're quite a big person, and maybe they're a little bit tougher on their garments. Maybe they've had garments in the past that haven't been, they've worn through quite quickly, or they've been able to pull them up really too high. So those people that are stronger in their hands than they imagine they are, and they pull on their garments too much and overstretch them. Perhaps gold punked could be their option for them. Gold punked is a flat knit garment. It comes in all the sizes, all the shapes. Here's an example of a knee high, quite a large knee high with an open toe. It's a very robust, fairly heavy weight flat knit. So it is quite firm. It is very stiff. Now that means that it can sit over shapes. It tends to sit over rather than crunch in or tighten in. What they've been able to do with gold punk though is to help with the donning and doffing of such a stiff flat knit, is that they've made the inside quite silky. So the inside fabric is quite silky feeling, which means that it's not terribly difficult to get on and off, given its higher levels of millimeters of mercury and the stiffness of the fabric. So a good choice for those that need something more robust in their compression. We move along to think about the circular knit options. So being realistic that circular knit garments do not suit everybody. They are perhaps more suitable for those that have a more regular leg shape, and not perhaps suitable for those people that are quite obese, or for those that have very soft tissue. Circular knit garments inherently within the way in which they're manufactured tend to coil. So we need to consider that in the prescription. And often what I've found is that those people who have had an unfortunate experience with compression garments in the past have perhaps been those that have been fitted into circular knit garments. In saying that though, circular knit garments do add value to what we have in our choice range. So a Vini garment, for example, on my lovely leg, my red leg, have garments that come with patterns. Although you won't be able to see this, I can feel the pattern on this and I can see it close up. And it comes in colours. So this is obviously a black, comes in navy, comes in white, comes in nice tan colours, and match that with the pattern, and you may find you get a pair of garments, or a garment that someone is willing to actually wear within their working day, for example. So it's a matter of mixing and matching and finding something that suits that individual's needs in terms of their compression and needs in terms of their daily life. If we move along now, looking for another sort of circular knit garment, Perhaps you do need something that is slightly stiffer. Maybe you don't need to go to a flat knit garment, but perhaps you do need something slightly stiffer, or perhaps you've got someone that has very sensitive skin. So you'd be looking perhaps for a garment with a cotton content. So Star Cotton has a cotton content within its knitting process. All of that cotton sits against the skin. So they've knitted it in such a way that the cotton is all sitting against the skin. And cotton inherently doesn't stretch, so you'll find that Star Cotton garments are stiffer by nature. They are not stiff like a flat knit, but they are definitely stiffer than the likes of a Veenie, which is very soft and stretchy. So Star Cotton garments come in all the shapes and sizes that you might need as well. Good for those with more sensitive skin, perhaps for those that need something slightly stretchier, slightly stiffer than a standard regular circular knit garment. Okay, so we move along now to look at Easywrap. Now, Easywrap is over here behind me. No, it's not. Here it is. Easywrap is such that it has different parts to it. So you'll see here that it has a liner sitting underneath. You always need the liner underneath. Perhaps you might put someone's wound care dressings below this liner and use the liner to hold everything in place securely. It then has single layer textile bands that are held with gripping fastenings. Each band is set at a 50% overlap automatically. So the band holds, the stitching at the back holds all the pieces together. So as you are wrapping the Easywrap on, you will bring the bands out to stretch, but you cannot overstretch these bands. So if you size your Easywrap correctly, you apply it with consistency. Because you cannot overstretch the bands, it will apply the compression that you're looking for. Easywrap comes in either light compression or strong compression. So you choose which is going to be suitable for your patient. It has a little foot piece that looks like a little bootie when it comes off. It's quite low profile, so most people find that they can wear their clothing over the top. So we move along to think to someone that has maybe a need for nighttime compression, or someone that really has not been able to manage any other compression. So perhaps, or you might need a combination of treatment modalities. So one thing we're looking at and seeing at the moment is that things that are different can sometimes be advantageous. So to combine different treatment modalities for the one patient care. Comfy Wave is made of undyed cotton. All of the cotton sits against the skin. It's very nice and soft and stretchy, very easy to get on and off. It has a wave pattern to it that obviously won't show on this plastic leg, but if you put it on your own leg or your own arm, you will get an indentation against the skin. Now, this helping with oxygenation to the tissues. It helps to encourage movement of lymph fluid. It is proving to be very comfortable, very tolerable, very easy to get on and off. So whilst it has been introduced as a night garment, we are seeing it used in multiple different situations and has been a real game changer in terms of those people that simply cannot get anything else on, won't tolerate anything else. You could use it on its own. People have been using it under a pump to help encourage greater improvement using the pump. Some people are using it only at night. Some people are using it during the day and the night. So it's got multiple places, multiple benefits and multiple uses. One thing of great interest that has been used a lot is the microfine toe cap. So the toe cap could, if you needed it to, replace bandaging of individual toes. It can help with forefoot swelling, and it can certainly help with individual toe swelling. It is nice and stretchy and lightweight. It is very silky, so the toes don't get stuck together. You can trim the length of each toe once you've put it on and measured as to what length the toes need to be. So it's quite customizable as well. The other thing that I think is worth mentioning, because I think it's a simple thing that we can all do to help make this whole process of garment donning and doffing easier, is to have a really good quality pair of gloves. Ones that I quite like are the Steve latex gloves. You can get them in latex free as well. However, I do find the latex gloves to be slightly grippier. The texture on the outside is rougher on the latex gloves. So these will help you grab and grip and pull the garment in place and move it around without snagging it and pulling it. The other really simple thing that you can do to help donning and doffing of a garment is using an open toe garment, using a glide, and basically the garment slides on and the glide pulls out. So these are really simple devices that I think are often forgotten. A pair of gloves and a glide can make all the difference in terms of garment donning and doffing. So I think that the emphasis needs to be on correct choice, understanding what garments offer in terms of the pros and cons of each different fabric type and the different millimeters of mercury. It's not just about the millimeters of mercury in your garment choice. It's a little bit about the fabric, how it responds, whether it's a flat knit or a circular knit, what we can expect from it, what some of the pros and the cons will be. And it will be different for each patient that you're looking at. And also, I guess, as well, looking at their past experience if they've had it. And importantly, how have they responded to treatment to date? Or are you putting them into a garment to begin the process? So it depends on where you are in your treatment regime as to what garment choice you might choose. So using the chart, using our guidelines, using our clinical advisory team as much as you'd like to. Our customer service girls will help guide you through on some issues. They will always put you forward to the clinical advisory team as required. So I think it's looking at problem solving, and it's looking at understanding all elements and becoming familiar and becoming comfortable with a range of garments. So we have further learning opportunities that you can look to. We have some measuring guidelines as well. Measuring these garments doesn't necessarily need to be complicated. And again, we can help guide through some decision making if you are uncertain about that. So hopefully this has given you a brief tour of different options of Haddenham Healthcare garments, what they offer, what they feel like and what they look like. Of course, it's difficult for you to be able to feel them through a webinar sort of format, but we can get samples to you if necessary, if we can get fabric swatches to you. So thank you very much. I hope that was helpful.